So let me say a few words about global health and the U.S. Um, our presence in global health wasn't something you saw in the news. It wasn't a victory parade. Rarely see it in a campaign. It was quieter than that. It was a box of malaria medicine arriving in a rural clinic just in time. It was a polio vaccine given to a child whose name we'll never know. It was a woman in South Africa walking through the door of a shelter, bruised but alive, knowing she was finally safe. And now it's gone. According to reporting from Stephanie Nolan at the New York Times, the Trump administration has slashed funding for some of the most effective health programs on earth. Not cut, not trimmed, erased. Example, $131 million polio immunization program, defunded. That money paid for the planning, logistics, and last mile delivery of vaccines, the boring, logistical, essential work of disease prevention. It's the kind of thing that stops a child from waking up one morning and realizing they can't move their legs. It's the kind of thing that doesn't seem important until it's not there anymore. A $90 million malaria program, gone. For the last 20 years, we've been a leader in the fight against malaria. We've been backing programs that have cut malaria deaths in half across much of sub-Saharan Africa. And this wasn't just a matter of sending medicine, though we did that too. It was infrastructure, logistics. It was the dull, vital, unglamorous work of delivering millions of bed nets, each coated with insecticide that kills mosquitoes before they can bite. It was rapid diagnostic tests so that when a child spiked a fever in a remote village, doctors didn't have to guess. It was life-saving medication so that if that test came back positive, God forbid, there was something they could do about it. And it wasn't just reactive. The program also funded mosquito control efforts, the teams that treated breeding sites. They sprayed insecticide in homes. They slowed transmission before it could start. That's all gone now. 53 million people left unprotected, 53 million chances for a mosquito to bite one person, then another, carrying the parasite with it. And these parasites cause malaria. The ones that do it, they mutate fast. So when treatment is interrupted, they develop resistance. So the next generation of malaria won't just be more widespread, it's going to be harder to treat. What about malnutrition programs? Malnutrition doesn't wait. It isn't a slow decline or a gradual wasting away. It's immediate. A child with severe acute malnutrition can go from barely holding on to gone in a matter of days. And without treatment, their body begins consuming itself, muscle, fat, organ tissue, until there's nothing left to fight with. Now, before these cuts, a USAID-funded program in Nigeria provided treatment for 5.6 million malnourished children and 1.7 million women. And it worked through 77 health centers. And many of these were in some of the most food insecure regions of the country, treating severe acute malnutrition, the kind that without intervention, it'll kill children in weeks. That program is now gone. 77 health centers have shut their doors. So the trained healthcare workers who once measured a child's arm circumference and decided whether they lived or died are no longer there. So the result, at least 60,000 children under the age of 5 are now at immediate risk of death. Malnutrition is not just hunger. It's a body turning against itself. It's stunted growth. It's a weakened immune system, increased risk of dying from something as simple as diarrhea. And it doesn't just stop with those 60,000 children. It affects the next generation. So a malnourished mother is more likely to give birth to an underweight baby, who in turn is more likely to suffer lifelong health consequences. So it's not just a single moment of suffering. It's a ripple effect that spans decades. Now, some cuts will be felt immediately. Others, it's going to take time to show their impact. In Uganda, the Baylor College of Medicine and their Children's Foundation ran a program that provided HIV and tuberculosis treatment for 46,000 people. That program has been defunded. This means tens of thousands of people who once had access to life-saving HIV meds, the treatment that keeps viral loads suppressed and it prevents transmission, they're going to be forced to stop taking it. Now, HIV treatment isn't like a round of antibiotics. You don't just stop and pick it up again when things get better. Stopping treatment leads to drug resistance. It allows the virus to come back stronger, harder to fight, and more likely to be passed on to partners and children. Now, TB treatment works the same way. So it takes 6 months of uninterrupted medication to cure tuberculosis. You miss a few doses, and the bacteria starts adapting. It mutates, and the strain becomes resistant to first-line drugs, which means the next course of treatment will be longer, harder, and exponentially more expensive. Now, this isn't just a Ugandan problem. Uganda isn't an island. People move, drug-resistant TB moves with them. Resistant strains are not going to stop at the border. So the impact of this one cut, just one among dozens, is going to be felt worldwide. Now, these cuts weren't debated. They were not presented to Congress. They were not reviewed by health experts or weighed against the consequences. They were essentially ordered by an unelected campaign donor with no background in public health, no expertise in infectious disease, and no interest in the lives of the people these programs served or those who had devoted their lives to serving these people. And they're being enforced without care, without consideration, without scrutiny. It's a blunt instrument being wielded against the world's most vulnerable, executed under the radar so that really by the time the suffering becomes undeniable, it's going to be too late to reverse. Now, USAID has never been a perfect institution. It's a massive aid organization, so it's had its inefficiencies, its missteps, its moments of bureaucracy, slowing down the urgency it was meant to serve. But, over the past decade, reforms have streamlined its operations. They've cut waste, they've prioritized evidence-based programs, the programs that work, the programs that save lives. So these cuts aren't about fixing USAID. They're about dismantling it. So what happens next? What happens when an Ebola outbreak flares up in Uganda and the contact tracers have all been laid off? What happens when a woman in South Africa tries to escape an abusive partner and the shelter she needed is nothing but an empty building? What happens when a 5-year-old in Nigeria is turned away from a clinic because there's no more funding for malnutrition treatment? What happens when a completely preventable epidemic isn't prevented? Well, what happens? People will suffer, people will die, and we'll call it a tragedy. We'll say that no one saw it coming, and we're going to act as if it wasn't the entirely predictable result of entirely deliberate choices. But this is what walking away looks like. This is what abandonment looks like. It's a disgrace. Call your representative and let them know.